There's surprisingly good news about one of the most common yet least talked about types of cancer. But how can you recognize the symptoms of a disease you've never heard of? It's endometrial cancer, and it's on the rise among American women. Changing the trend depends on knowing the symptoms and spreading the word. I'm Dr. Oswai, and this is The Balance.
So Lourdes, I understand that we belong to a very special club.
Very special.
My name is Helen Johnson Grishman. I'll be 80 years old this coming Christmas time.
How was your entry to this club?
Being a mature woman and having gone through so much in life already, it was a different experience. I went to a wedding. When we got there, I was feeling very tired, and I lay down on the bed to rest. When I woke up, I swung my feet across the bed, and as I stood up, blood came gushing out of my body.
Some cancers really have become very well publicized, for example, breast cancer, but endometrial cancer is the most common type of cancer for women in the United States of America.
I went to a Montefiore hospital, and they proceeded to give me all the tests. It's starting to calculate in my head that I am in trouble.
Yeah.
She said, well, this is the result, and of course I turned pale.
Most of the patients that I see who have endometrial cancer are older. For the younger patients, there is a lot more at stake.
My name is Lourdes. I am a Reiki practitioner.
How did you get sick?
It started 2016. A lot of abnormal menstrual cycles, pain, and I was bleeding constantly. I had my period for 2 years straight. And I just kept going to doctors and kept getting ignored. It was always just lose weight and it would get better. Cancer was never put on the table. It was always endometriosis.
For the younger patients, often their diagnosis has been very confused, and they may have had years of abnormal bleeding that people have just brushed off as a normal part of being a woman.
They set me up with a specialist. She did a couple of tests, ran some scans. She said endometrial cancer, and I'm just like, I'm going to have to research this one. Something that could have been maybe seen before, got to the stage of stage 3. And I've never expected, me being 30 years old, just celebrating my 30th birthday, to have cancer.
One thing that people should know is that it is very curable when it is caught early. Awareness means that you can find the cancer when it's a stage 1. Stage 1 cancer is 90% curable by surgery alone.
If you go for early intervention, when you know there's something wrong, if the doctors aren't giving you the right answer, you just don't accept it.
I know not to wait 2 years. I know not to just take answers like lose a little bit of weight.
Women need to believe that they are valued. They need to know that their symptoms are real and that they need to be listened to.
I knew women who had ignored this. Either they were embarrassed or they didn't want to talk about it. And they got themselves into some pretty serious problems.
You have to advocate for yourself. These are not normal symptoms, you know?
When these things happen to you, there is nothing to be embarrassed about. There's nothing to be ashamed about. There's always some person to whom you can speak who will encourage you to see a doctor, or a doctor who will listen to you.
If I had one wish for endometrial cancer care, I would put up a billboard on the interstate that says, if you have abnormal vaginal bleeding or bleeding after menopause, it's not your fault. This is abnormal. Please see your doctor.
I just joined this Facebook group. Any chance I get, I'm like listening and commenting, helping someone else out if they have any questions.
Lourdes, she has taken this experience and taken it as a tool to help other women.
My advice to anyone who is feeling anything wrong is to, one, advocate for yourself, and two, go to someone who will listen. Actively listen.
You know your body better than anyone else. If you have abnormal vaginal bleeding or bleeding after menopause, make some noise. I hope you will take the advice of Helen and Lourdes. Be your own best advocate. I'm Dr. Ozwa, and this has been The Balance. Until next time, be well.